Good morning. I am excited today to discuss with you a program that I put together. It's going to be called Building Better Lives. According to North Dakota Department of Health, less than 50% of North Dakotans meet the recommended physical activity. 17% of deaths in North Dakota last year were related to cardiovascular disease. In that same time, North Dakota estimated spending about $525 million in healthcare related to cardiovascular disease. This has led me to have a goal of reducing the cost of healthcare related to cardiovascular disease and to improve lives. The focus for me was looking at primary care providers who are better able to identify risk through screenings at regular routine appointments. The referrals for the program that I've put together would be patients who score at higher risk for cardiovascular disease at these routine appointments, as well as patients who do not meet the recommended standards for physical activity that could have that linked to mental health. In our area, Sanford Healthcare is widely used. The screening tools that Sanford's primary care physicians use are the Framingham Cardiovascular Risk Assessment for men and women, as well as a self-report for physical activity. These would be the same screening tools that would be used in this program before, during, and after the program for the follow-ups. The protocol for the Building Better Lives program, it's a 6-week program with a layout of 2 meetings per week. The first meeting of each week is going to focus on education of both health and mental health, resources, handouts. We always want to make time for discussion for all the participants with each other, with the group facilitator, and with guest speakers. The guest speakers are going to be professionals that work in this area that could potentially already have a connection with our patients. The second meeting of the week is going to be focusing on building better habits and focusing on aerobics and strength training. After the 6-week program, we would like to have surveys, not just to follow up on the progress of the patients or how they have built habits or what they've maintained, but also the feedback. As they go through this journey, we would like to see their feedback over the next year on what could have been beneficial in the program, things that they believe should be added to, or maybe things that weren't as relevant so that we can continue to make this program better. A DBH would make a very strong hub for the referrals from the primary care providers and other providers in the community that are seeing a need for a referral for a patient. A DBH would make a strong group facilitator in that they can set up the guest speakers who again are going to be professionals in this community. They will be more equipped to do follow-up contact and assessments with the patients who complete the program. And they're going to be well versed in referrals that patients might need or have benefit from after the program if they see that there is a need. A DBH is a good point of contact for patients before, during, and after this program, as well as in the primary care provider's facility. Another thing that would be needed for this program is either a gym or recreational pass to help patients be able to see the resources in the community, places that they could go to increase their physical activity if for some reason the resources in their hometown or in their home don't meet what they need. The results that we're expecting from this program are going to be that patients will be able to have better habits and have built better physical activity standards for themselves, that they better understand how increased physical activity can benefit them both with their physical health and mental health, increase psychoeducation, have better understandings of health benefits overall, even if it is above and beyond what physical activity can do to reduce their cardiovascular risk. And patients should be able to use resources provided to continue healthier habits. Those could be resources like apps on their phone, handouts, those connections with the community providers or professionals in the area, or perhaps they use that DBH in the future as well to continue their journey. We will continue to use the North Dakota Department of Health status assessment report to track, even after the year, track if these improved physical activity habits have been able to be seen as an impact for the state and for the finances as far as uh, the cost for health and for the patients, for the primary care providers. I would also like to continue to keep in close contact with North Dakota's providers so that we could have their insight and more information and their feedback from the patients that have gone through this program. Now, this has been a short and very brief overview of the program that's geared towards reducing the risk for cardiovascular disease by increasing physical activity and providing some of that psychoeducation and resources through this program. I hope that this program can continue to be something that primary care providers can refer to in an attempt to try and reduce risk and improve lives for North Dakotans. If you have any questions about the protocol, the way we can refer, the resources that we might be using or might need in the future, or how we track that progress. If there's any sorts of recommendations that you would have to improve this program, I would really appreciate the feedback. Please go ahead and contact me at the following email.